Good morning, everyone. Welcome to our webinar. My name is Ayman, and I will be your host and moderator for this event. To make sure that you are connecting well with our guest speaker, during the presentation, he will interact with the audience, and you may post your inquiries or responses at the YouTube comments or Facebook comments, after which we shall highlight on the screen. And during at the end, there will be a Q&A session where you may post your questions at the comments so that he may answer you. So, to begin with our program for today, I would like to call upon Ms. Wan Nur Aina, our program leader for psychology in APU, to say a few words.
Thank you, Aiman. Hello and good morning, everyone. Welcome to our first psychology webinar for this year with our topic, Keeping Up with the Clinical Psychologist. And for those who don't know me, my name is Aina, and I'm the new program leader for psychology. And I would like to take this opportunity to thank our honorable guest speaker, Mr. Abdul Raouf. Thank you for spending your time despite your busy schedule. And thank you, Justin. And thank you, Priya from the Mencoach Psychology Center. Thank you, Aiman. Thank you, Nabila, for arranging this for me. And as everyone knows, psychology program in APU is very, very new. The first batch started last year in June. And now we have 3 cohorts with total number of 14 students. And I'm sure the number will going up in the next March intake. And I would say that this might be your first time, right? Your first time get to learn from a practitioner, someone with an industrial and clinical background. And my idea of inviting a guest speaker from from outside to bring some sort of real world relevant and career exposure to our students, and also to inspire our students. And to my dear students, don't worry, in APU, you will not only learn by books, by theories, by lectures, tutorials, but you will also get practical and industrial exposures as well. And I know some of you all this while, your learning experiences, your classroom interactions will only be with you, your lectures, and your classmates only, right? And I'm sure by now, some of you already bored with my face, with my lectures almost every day, every week. But today, we have someone special. We bring you someone special, handsome and young guest speaker who is now a successful clinical psychologist, Mr. Abdul Raouf. And for everyone's information, actually I got to know Mr. Raouf from Miss Tanjina Han. Miss Tanjina was one of my ex-students from my previous institution. She graduated in Bachelor of Science in Psychology back in 2017 or 2018, if I'm not mistaken. And now she is a successful mental health professional and founder and CEO of Mencoach Psychology Center. And I believe this is one of the leading psychology centers in Kuala Lumpur, right? And Mr. Abdul Raouf is one of her team member working as a clinical psychologist there. And Mr. Abdul Raouf, so I hope today's webinar can inspire my students to have a better understanding of your profession as a clinical psychologist. And maybe who knows, and they might be following your footsteps in the future. And on behalf of psychology program, School of Marketing and Management in APU, once again, thank you so much, Mr. Raouf, for your willingness to be with us today. And to my students or potential students out there, please grab this opportunity to gain insights and to equip yourself with knowledge, skills needed for your future career. And thank you, everyone, and enjoy your session. Back to you, Aiman.
Thank you, Ms. Aina, for the warm welcoming speech. Now, it is with great pleasure that I will introduce our guest speaker. He has done his Bachelor of Psychology from the Help University of Malaysia and has completed his Master's in Clinical Psychology from the Integrated Psychology Program under Science University Malaysia and Sultan Idris Education University. So please, without further ado, please welcome us in joining Mr. Abdul Raouf.
All right. Okay. Thank you for the introduction. Thank you, Mr. Aiman, as well as Miss Aina for the introduction. Okay. So, yeah, I want to say thank you for the organizers for inviting me to give this talk. Okay. But before I start giving the talk, I just want to share a little bit. So, when I was invited to give this talk, right, my first thoughts was actually that I was thinking, am I the right person to give this talk? Am I qualified enough? Do I have enough experience? Because at the end of the day, I feel like I'm still new in the field, right? But also, I reminded myself, I told myself that, well, if I had an opportunity to just share the things I know about clinical psychology, as well as to answer as many questions I can about anything you might be curious about the field, then I'd be more than happy to do that. Because my goal for today is to motivate and to convince as many people as I can to take part in clinical psychology. If I can convince most of you to take clinical psychology, I would consider that as a mission success. Okay, so um, without further ado, let's head on to the topic for today. Okay, so you can see my slide, right, Mr. Ayman?
Yes, Ken, no problem.
Okay, all right, okay. So, okay, I'll start with some brief introductions about myself. Yeah, has been mentioned just now by Mr. Aiman. I'm currently working as a clinical psychologist in Mancoach. I'm also registered under Persatuan Psychology Malaysia, also known as SIMA. So yeah, some of my education was I did degree in Health University for 3 years, and then I took a break for 2 years, but I didn't enjoy in these 2 years of break. In these 2 years, I did a lot of different jobs just to gain experience. So after 2 years of getting experience, I joined my master's, which is in the conjoined program of USM and UPSI. Okay, so here I just want to share a little bit of my training experience when I was in my master's. So one of the first experience I had was working in Hospital Pulau Pinang. I was here for about 6 months and I was attached under clinical psychologist. So this clinical psychologist was like my supervisor. She was the person who would give me cases, teach me whether I'm doing things the right way, as well as teach me how to use the assessment tools. Okay. And another benefit of having a supervisor is that she would help to make sure that I get experience in all the disorders. For example, if I've already seen someone with anxiety, then she would provide me with someone with some other disorder so that I'll be experienced with all the disorders. Right? Besides that, working in hospital, the other benefit is you have these meetings called grand ward rounds as well as continuous medical education. The purpose of these two meetings, although it can be quite intimidating at times, but yeah, the purpose of this meeting is to educate junior doctors as well as junior psychologists about how to understand the cases, how to treat the cases, right? On top of psychologists learning about mental health, we can also learn about how doctors treat mental health, right? So useful extra information for us. But yeah, overall, working in a hospital was a truly great experience. But at the same time, in hospitals, there are a lot of patients. And because there are a lot of patients, if you want to work there effectively, you have to be organized and being able to work in groups, as well as being able to work with time constraints. All right, so my next experience while master's was in Atfal Jannah Psychological and Rehabilitation Center. I was here also for 6 months, but my experience here was very different from my experience in hospital because here I worked mostly with only children from the ages of 3 to 16. Since I was working with children, the kinds of difficulties that they would have are like autism, ADHD, learning disabilities such as dyslexia, dyscalculia, as well as intellectual disability, which refers to people with the IQ of lower than 70. So, on top of giving therapy to the kids, I would also provide parenting training to the parents because, understandably, parenting kids who have learning disabilities or have special needs, right, can be very difficult for a lot of parents because the techniques that you use are different. Okay? Because they might have different emotional needs, different sensory needs, as well as different behavioral problems. Okay, so yeah, parenting training was something we do often as well. Besides that, when we want to do therapy to the kids, the form of therapy that we use often is applied behavioral analysis, also known as ABA. So I don't want to go too deep into ABA, but the basic information, basic understanding of ABA is that uses reinforcements as well as punishments. Reinforcements is the things you do to increase a desired behavior. Punishments are the things you do to decrease undesired behavior. Under reinforcements, there's positive and negative reinforcements. Under punishments, there are also positive and negative punishments. I wouldn't go too deep into this because that's not the purpose of this talk. But yeah, ABA was something that we use predominantly when working with kids as a clinical psychologist. Okay, so here's some pictures I want to share from Atfal Jannah. So at the top left here, this is the usual situation where kids would sit and eat. Some kids are able to eat independently, but some of them, they need to be fed. And some also, they hate eating. They only like to eat like junk food, like snacks and burger. But when they're given soft foods like rice or mee, they wouldn't like that. They would start crying. So yeah, it would be a difficult task for the social workers working here. And if you notice, there's also a a chair that's empty, and there's a plate but there's no kid there. It's because this kid is on the top right photo. He's very hyperactive, and when he eats, he cannot just sit down and eat. He would take one bite and run around, and then come back, take one bite and run around. Yeah, in this example, he came to me, sat beside me to just like annoy me, I guess. Yeah. So working in a kid center, it's truly a rewarding experience because some of the kids, it's hard for them to follow instructions. But sometimes when you persevere and you keep pushing, you might just be able to crack them a little bit. You might be able to get them to listen to you, to follow your instructions, to improve their behavior. And at this point, it will feel truly rewarding because now you can share the tips you have to the parents, and the parents will also feel a lot calmer at home. They wouldn't be as stressed. Right? So yeah, a lot of great experiences working with a kid center. So here's some other experiences I have. So these are 4 jobs that I worked in between my degree and my master's. So in the 2 years of doing different jobs, this is what I was doing. So right after my degree, I took up internship in HKL. And so I was here for about 3 months. And then after that, I spent another 3 months in MMHA. Okay. At this point, I had already spent 6 months of internship, and I felt like I was done working without money, right? So, and then I decided to apply for Souls 24/7, which is my first paid job. So here I was working as a shadow aide. Shadow aide, to those who don't know, is like a teacher's assistant, but your job is to focus on kids with special needs. So you will help them to focus in class, to improve their behavior, and to help them to make friends. Yeah. Besides that, I would also work in Kumon. So the reason I worked in Kumon as well as Soul 24/7 was because at this point in time, I wanted to improve my experience working with kids. Because at that point in time, I wasn't comfortable working with kids. But instead of just letting my hand go, instead of just calling it a day, I made an effort to improve my skill before I started my master's, because I knew once I started my master's, I would go to practicum and have to handle kids. So I needed the skill of getting close to kids before I started my master's. Hence, I did both of these jobs. Okay, so yeah, before I talk about psychology, before I talk about clinical psychology, I just want to explain a point that a lot of people struggle to understand. And that is the difference between clinical psychology, counselor, and psychiatrist. So to answer this question, right, I've designed here a very easy to understand diagram. Okay, so yeah, there's some mistakes in the format here, but no problem. We'll go through it one by one. So, medications. Do they give medications? Psychiatrists are the only one among all 3 of these that provides medications, because psychiatrists, at the end of the day, they are doctors. right? They are trained in medicine. They're trained in using medications to treat illnesses. So yes, when it comes to prescribing medications, psychiatrists are the only one who can do that. Psychologists and counselors do not prescribe medications. Do they treat mental illnesses? So yes, psychiatrists and clinical psychologists, they do treat mental illness. Counselors, they only sometimes treat mental illness because counselors, they are not trained to diagnose as well as they're not trained to treat mental illness. But sometimes counselors, they might take up workshops, might take up seminars where they train to handle mental illness. So yeah, there are some counselors who can treat mental illness. So do they diagnose? Psychiatrists and clinical psychologists, they do diagnose. Okay. Counselors, however, do not diagnose because they are not trained to diagnose in mental illness. Do they do psychological assessments? Well, the only person who does psychological assessment are clinical psychologists. Okay. Psychiatrists, they would do different forms of assessment. For example, they would check the blood, check the weight, right? For example, checking the physical and physiological symptoms. Whereas psychologists will check the psychological symptoms. Okay, so do they do talk therapy? So psychiatrists, similar to counselors, sometimes they will do talk therapy because some psychiatrists, they would take up workshops, take up seminars that teach them to handle talk therapies. So yeah, sometimes you would meet psychiatrists who would conduct therapies as well. But this is very rare, actually. Most psychiatrists that you will see in the psychiatric department or most housemen or medical officers, they are not trained in talk therapy. And their form of treatment is mostly on medications, right? So clinical psychologists and counselors, yes, they do talk therapy. All right, so finally, do we need more of them? For sure, we definitely need more of psychiatrists. We also need more of counselors. For clinical psychologists, I would say we need way, way, way more of it, right? Because the number of psychiatrists, the number of counselors per a group of population is not enough. But still, it's more than the amount of psychologists we have, especially the amount of psychologists we have in the government sector. We do have some psychologists in the private sector, but the most of the people who seek psychological treatment would go to KKM. And in KKM is where we need the most amount of psychologists. And unfortunately, we're still to have enough. So yes, which is why I'm doing this talk, to influence more people to take up clinical psychology. All right, so with that out of the way, let's talk about what is psychology. So briefly, psychology is the study of the mind, the thought, and behavior. So because it's the study of the mind, the thought, and behavior, those are very general topics. So understandably, psychology would study about wide variety of different things. I'm sure most of you will be aware of this. For example, psychology will study about brain changes after injury, workplace motivation and productivity, safety science in factories, athletic performance, and even treatment of mental illnesses. Okay, so because there's different things a psychologist studies, therefore, there's going to be different branches of psychology. Okay, there's way more branches of psychology, but here I only picked the 6 common ones that you would find in Malaysia, and 6 common ones that if you wish to, you can pursue in Malaysia. All right, so let's go through them one by one. Firstly, there's forensic psychology. Forensic psychologists, they focus on the psychological assessment of individuals who are involved in one way or another in medico-legal cases. Medico-legal cases, as the name suggests, are medical cases which are also involved in legal disputes, right? For example, abuse cases where someone is being treated in the hospital because of the abuse, and because this person has been abused, therefore it becomes a legal case. Other than that, there's also substance abuse cases because using drugs is illegal, and sometimes when people use drugs, they can become overdose and require medical attention. So after they are treated, then there will be a court case, right? So another form of medical legal case is the mens rea case, or commonly known as the insanity case. What is done here is that forensic psychologists, they will determine whether this person is able or not to differentiate what is right from what is wrong. This is important because sometimes in court cases, some people might claim that they are mentally unhealthy. And because they are mentally unhealthy, that's why they committed the crime, right? Example, someone might say that I heard voices and the voices told me to commit the crime. It's not my fault, the voices told me to do it. So at this point, the court would categorize this as a medical legal case because now this person is saying that they might have a mental illness. So the forensic psychologist has to use interrogation techniques and interview techniques to find out whether this person is telling the truth or are they lying. All right. So now let's go to developmental psychologists. So they focus on the social, emotional, behavioral, and cognitive development across lifespan. So they have a strong focus on children with neurodevelopmental disorders. What I mean by this are ADHD, autism, learning disabilities. They also focus on kids with speech disorders. For example, kids who stutter, as well as autistic individuals who are non-verbal, meaning they cannot communicate. Yeah. They also focus on motor skills as well as social and cultural influences on children, meaning how the environment of the children affects them, their family dynamics, the school they go to, the neighborhood they grow up in. All this can have an effect on the upbringing of the child. So similar to what clinical psychologist does, developmental psychologist also has a strong focus on applied behavioral analysis. All right, so next, let's talk about educational psychology. So it has a focus on the exploration of how people learn, the teaching methods, as well as the individual differences in learning. Okay, so they have an emphasis on educational technology, meaning the incorporation of technology to make teaching more easier. For example, what we're seeing more often nowadays is the incorporation of iPads and then we use apps in the iPad to teach students about programming, right? To teach students about understanding the world better. So there's a lot of benefits of using iPad because they get to touch, they get to see things more clearly. So for kids with special needs, there's definitely a lot of benefits. So yeah, educational psychologists also takes part in curriculum development. So they design the curriculum to fit the needs of each child. Because understandably, kids with special needs, some of them are better learning in some way, maybe better learning from visual cues. Some of them are better learning from auditory cues. So yeah, after assessing them, the educational psychologist will tailor a curriculum suitable for them. All right. Let's go to industrial and organizational psychology. So they have a focus on improving working efficiency in the workplace. They also aim to improve productivity, cooperation, and job satisfaction. Among the rules they have is to recruit new people, they train employees, as well as they do performance reviews. So at this point, you might be thinking to yourself, IO psychology and human resource sounds very similar. To that, I would say yes, they're very much alike because they both do recruitment, they both train employees, and they both do performance reviews. But where they differ is that a human resource is employed by the company, right? They work for the company. Whereas IO psychologists, they are not employed by the company. They are usually consultants and they work independently. So they would be consultants to multiple companies at once, not just working for one company. Okay. So human resource, they're also mainly trained to improve company efficiency as a general, right? Improve everyone's efficiency as a general. IO psychologists, they also do that, but they also have an emphasis on individual mental health problems. So yes, IO psychologists can do slightly a bit more than a human resource. All right, next let's talk about health psychology. So health psychology, they have a focus on promoting health as well as the prevention and treatment of diseases and illnesses. So they don't only focus on psychological disorders, they focus on all kinds of illnesses. Okay. while giving their talks, they use the biopsychosocial model, which refers to how biology, psychology, as well as social factors all come together to interact to cause the illnesses, right? And when you want to treat the illnesses, it's also better to utilize all these different factors together. So the kinds of things they focus on are stress reduction, having a balanced diet, weight management, as well as smoking cessation. Okay. So most of what they do is they provide talks and they give training programs. So sometimes they also do consultancies, but most of their work rule is in giving talk, as well as webinars and workshops, similar to what is done now. Okay, so now let's talk about the main thing everyone wants to hear today, right? Let's talk about clinical psychology. So clinical psychology is a specialty with a focus in diagnosing, treating, and prevention of mental illnesses. So the three main things done by all clinical psychologists is they do clinical assessment and diagnosis, they treat mental illnesses, as well as they educate. All right, first let's talk about clinical assessments. So clinical assessments are basically process of collecting information, and you draw conclusions through one or all of these four techniques, which are observation, psychological tests, neurological tests, and interviews. So not all clients will go through all of this. Some will only go through interview, some will only go through interview and psychological tests, some will only go through observations. So yes, it's dependent on the case. But what's for certain is that all clients of a clinical psychologist will undergo a clinical assessment. Because it's important, because it's to determine the pre-treatment functioning. Because we want to know the abilities of the patient before they are treated. For example, maybe before treatment, the person is having very high anxiety about going out. Because they're anxious about going out, they would prefer to isolate themselves at home, and they cannot focus in their job. But after they've gone through treatment, they notice that suddenly they can go out more and they can interact with their friends, they are doing more things outdoors. So this way we can see that that's a definite change after treatment than compared to without treatment. Yeah. Besides that, assessments are also important to plan the treatment, right? Because without knowing what are the areas of concern, without knowing what is the diagnosis, it'd be difficult to plan how to help the patient. And finally, clinical assessments are important for case formulation. Case formulation is basically taking together all the information from the interviews, and you observe and try to understand which areas are the main areas of concern. And these areas of concern are where the treatment will be targeted towards. Okay. All right, so now let's talk about observation. So here I took one example of observation, okay, and it's called mental status examination. So MSE is something that is done for every patient or client in every session, okay. The purpose of this is just to gauge their physical appearance, their behavior, and their speech. Because sometimes for some people, in one session, they may appear normal, right? But in the next session, the way they dress is untidy, they might look unhygienic, they might look unkept and disorganized. And this might indicate something, right? Besides that, we also look at their speech, whether or not their speech is normal tone, the rate of speech, is it fast or slow? When you ask them question, can they answer the questions in a goal-orientated manner? Or do they answer it in, for example, you ask them a question, they probably don't answer the question and they talk about something else entirely. Okay? All this can indicate some concerns. All right. So now let's look at example of psychological tests. So this test is called the Wechsler's Adult Intelligence Scale, or easily it's just referred to as WAIS-4. So when you hear people having, like, people say they have IQ of 140, or people having an average IQ of 100, what that refers to is this test, right? It's an IQ test. And yeah, I wouldn't go too deep into this. If you have any questions, you can ask me later. But yeah, I'll just share with you some of the examples of tests that are present in this psychological assessment. So in the middle here, you will see the block design test. So here you see the 9 blocks, and what the patient has to do is they have to take 9 blocks and arrange it in a way that it's similar to the diagram beside here. Yeah, it sounds simple, but because there's a time constraint and because the questions gets harder over time, so yeah, most people would struggle to complete this test until the end. Yeah. And on the right here, there's another example. This is called the picture completion test. So the patient will be shown the diagram on the above, and then they have to choose the pictures at the bottom. That the pictures, if they put it together, it will be identical to the picture above. So for example, the answer for this would be 6, 1, and 2. Because if you take the images in number 6, 1, and 2, and we put it together, it will look identical to the diagram above. Yeah. So examples of tests inside the psychological assessment. Next, let's look at neurological assessments. So one example I took here is the Kaplan-Baycrest Neurocognitive Assessment, also known as KBNA. So yeah, doing neurological assessment is important because sometimes we want to find out which areas of the brain are affected, right? If someone has gone through a traumatic brain injury, maybe through accidents, or someone has gone through seizures, sometimes this can cause brain injuries in certain parts of the brain. But we don't know which areas of the brain are affected, right? So when we do neurological tests and when we find out that, oh, this person has problems in their attention, has problems in their working memory, or has problems in their verbal fluency, then we have a rough idea of which areas of the brain might be affected. So the treatment methods will be tailored based on the results of the test. Right, yeah. Similarly, if you have any more questions, you can always ask me later. Okay, so yeah, here's another test that is commonly used. It's called the Violent Adaptive Behavior Scale, or simply called as VAPS. So VAPS is usually conducted on children, and the purpose of it is to kind of gauge the severity of their difficulties in each of the different domains. So for example, we do the test on the child and we find out the child has difficulties in their socialization. Then the bulk of the treatment will be focused on their socialization. And then after a year, we would retest and then see if there's any improvements in their socialization. If there's none, then we know that maybe a different form of treatment should be recommended. Yeah. Okay, so just want to talk a little bit about clinical assessments. So assessments is an ongoing process and it does not end after the first assessment, right? After the first session. Because over time, the more you see the patient, sometimes the more information you will get. And based on this new information, you might need to tailor the treatment method slightly different. So yes, definitely. Assessments are something that is ongoing and doesn't stop after the first session. Okay, so next let's talk about diagnosis. So when psychologists or psychiatrists, when they want to diagnose, the book that they will refer to, a book that we can consider as like the holy Bible of the field of mental health, right? Is the DSM-5. This DSM-5 is a book where all the disorders that you've heard of, depression, anxiety, personality disorders, bipolar disorders, anything you've heard of, it will be listed inside this book. Okay, as well as all the criteria that are needed to be diagnosed with the disorder. Yep, it's a very well-known used book, but at the same time, it doesn't mean that it doesn't have any critics. So some of the critics, again, DSM is that because there's a lot of criteria and there's a lot of diagnosis, labelings can be stigmatizing, right? When someone is diagnosed with depression, and then the label of depression can be used to stigmatize the individual, right? Which can lead to adverse outcomes. All right, next let's talk about treatment. So predominantly treatment in psychology is done through psychotherapy, or also known as talk therapy. Besides that, it's also done through working alongside other health professionals. Okay, the kinds of disorders that are treated are any disorders of the cognitive, emotions, as well as behavioral problems. Okay, and yeah, as mentioned just now, working as a clinical psychologist, you wouldn't be working alone. Most of the time, you'll be working with a bunch of other health professionals, especially if you're working in a hospital. You'll be working alongside housemen, medical officers, psychiatrists, nurses, occupational therapists, NGOs, and there's a lot more actually, right? So definitely, it's a field where you have to work in a team. All right, let's talk about the types of treatment. So one of the most commonly used technique in clinical psychology is called psychoeducation. Psychoeducation basically refers to educating the client regarding psychological knowledge. Right? So the kinds of things you would teach is like informing them about their diagnosis, telling them about the symptoms and the struggles they might have, as well as informing them about the side effects of their medication and also the recommendations provided for them. Okay. Other things we do also include stress and anger management, social skills and assertiveness training, and also not to forget the bread and butter of clinical psychologists, right? Are these treatment modalities, which are cognitive behavioral therapy, dialectic behavioral therapy, acceptance and commitment therapy, and psychoanalysis. For me, the technique that I use predominantly and the technique that I was trained in is cognitive behavioral therapy. Okay, so let's talk a bit about the types of treatment. Is one treatment modality better than the other? Well, definitely not, right? For example, CBT. CBT is something that is widely used all over the world. And for a lot of different types of disorders, when you Google for the treatment method, most likely it would say CBT. So does it mean CBT is the best? Surely not. CBT has its benefits, and CBT is something that can help a majority of people, but doesn't mean everyone can fit into this model of CBT, right? Because humans are very varied. Different humans have different needs and different ideals, different values. So surely one type of treatment wouldn't work for everyone, which is why what I always suggest is to improve our skill set. Make sure that we have different skills and different tools so that when we face different problems, we have different skills and different tools to pick and choose from to handle the problem, right? Which is better than only helping a specific type of population. And when there's a different population, a different problem arise, we suddenly have no resources to help this person, right? Which is why working as a psychologist as well as working in any healthcare field, it's always important to improve our knowledge and to keep on learning, right? Because learning in this field, it never stops. New findings are always happen, and it's always important to update ourselves. All right. Other things a psychologist would do is also education. Education towards other psychologists in terms of seminars, supervision sessions, as well as towards general public, right, through workshops. Some of the other things a psychologist would do are consultations, research, teaching, as well as administrative duties, which includes report writing. When we conduct assessments, for each assessment, there will be a report writing. So yeah, report writing will also take up a bunch of the time. There's also case notes. So for every psychotherapy session that we have, we would have to write the case notes. Okay. Sometimes the case notes might take even longer than the therapy itself. All right, so here I made like a pie chart just to give an idea about the percentage of time each psychologist spends in different activities. Okay, and if you can see here, a bulk of the activity that is done by a psychologist is through psychotherapy, which is 42%. Almost half of the time is through psychotherapy, right? Which is understandable because that's like the bread and butter of being a psychologist. Other than that, we also conduct a lot of assessments like diagnosis and so on. Yeah. But yeah, the bulk of it is definitely psychotherapy and assessments. All right. So yeah, I want to talk just to summarize the topic of clinical psychology. I just want to highlight the importance of psychology as a discipline. So understandably, as a lot of people are becoming more aware now, mental health concerns are on rise, which is the pandemic. More people are realizing they require help. More people are realizing that the problems they have are becoming more and more serious the more they are trapped inside their house, right? So definitely, as more people are struggling with mental health, there's a high demand of clinical psychologists at the moment. And a lot of the clinical psychologists working right now, they all speak of the same problem, which is having a lot of clients, right? Because there's not enough of psychologists. Yes. Besides that, psychologists, they're also trained for treatment of mental illness, and they're also trained in assessment, consultation, and the prevention of mental illness. So it's not just one area. They can do multiple things, right? Besides that, a clinical psychologist is also a very versatile field. It is a versatile field because a psychologist can work in a hospital, work in a private center. They can even work in drug rehabs. They can work in child centers, as well as working in NGOs to become frontliners to the um, underprivileged populations, right? So yeah, if you're interested in mental illness, then yeah, when you take part in clinical psychology, there's a lot of things that a clinical psychologist can take part in. All right, so I just want to talk about why I love this field and why I chose this field. Okay, so one of the main reasons why I chose this field is since I was young, I've always been someone who enjoys helping people. When I help people, it gives me a sort of satisfaction, right? And reason I chose psychology to help people is because in the field of psychology, you would help them make life altering differences. Because anything that you teach them, anything that you say to them, might stick with them for decades and decades. So it's not just changing their problems now, it's giving them tools and techniques that they can use for decades and decades. Right? Besides that, psychology also focuses on problems that humans face on a daily basis. Because it's problems humans face on a daily basis, by seeing these clients, it also teaches me to understand more about myself, right? To understand about my weaknesses, my strengths, and how to improve myself. Yeah, and finally, working in this field of clinical psychology, it never feels repetitive, never feels boring. Because humans, at the end of the day, they are a product of the environment and product of their biology, which means that every case that you see are always very different. Two people having depression can have different symptoms, and the problems they have can be very different, right? So yeah, despite seeing people of same disorders, but the problems they have, the things they talk about, the concerns they have would be very different, which is why every client that you see would feel brand new and would feel exciting. Okay, so I've talked about why I love this field. Let's now talk about, are there any cons or challenges of being a clinical psychologist? So among the primary challenge of being a clinical psychologist is the empathy fatigue. Empathy fatigue refers to um, feeling there's lack of empathy to provide to the people around us, right? Because at the end of the day, empathy can be thought of as the limited resources. The more you give empathy to your clients, the more you will notice that you don't have any more empathy for your friends and for your family. And when this happens, you notice that you would start to become irritable around them. You do not want to interact with them as much. You want to isolate yourself. And the things you used to enjoy to do, right, you wouldn't do anymore. Yeah, empathy fatigue is something that a lot of psychologists have gone through. There's also the challenge of working within ambiguity. So, as a freshly graduated clinical psychologist, there's definitely going to be a time where there's a lot of self doubts, a lot of insecurities, and a lot of questioning your abilities, right? So, at this point, it's always important to seek guidance, to seek a mentor, to have a supervision, right? Because when we have obstacles, it's best to speak to someone else to help to make this obstacle a bit more clearer. So, yeah, other than that, our neighbors and friends can also start to have like a therapy like interaction, right? And yeah, sometimes when you have empathy fatigue and then they ask you about their concerns, and then when you understandably in psychology, right, you can't give them like easy solution. For example, they say that they are stressed, they say they're depressed, and then we can't give them an easy solution and suddenly, oh, they know how to solve their problem. They are suddenly not stressed anymore. Treatment in psychology doesn't work like that. There's ongoing therapy for a few sessions, and after that, then you will only see changes, right? But yeah, sometimes our neighbors and friends they can question our credibility once they find out that we can't solve their problems after one talk, right? Yeah, something we have to get used to. Another challenge of being a clinical psychologist is also to constantly maintain confidentiality, even among our colleagues. Because understandably, we would hear a lot of problems from our patients, right? And all these problems, we would have to keep it confidential. And for some people, this can feel like a lot of load, a lot of burden being put on their shoulders. And it can stress a lot of people out. Yeah, something to consider as well, right? But yeah, although there are challenges of being a clinical psychologist, there are also techniques to make this process a lot easier, a lot simpler to manage. Okay, so here are some tips that I can give to do well in the field of clinical psychology. So, firstly, is to get involved. As I've said before, working in the field of clinical psychology, you will have to work alongside different professionals. And if you're used to working alone, then yeah, now is a good time to improve the skill of working in teams, right? So after the degree, it's a good opportunity for all of you to seek up jobs that can improve your skills in team working. Okay, as well as but there's always going to be boundaries, always going to be obstacles, and when there are obstacles, it's always important to seek support, seek mentorship. Okay, yeah. Second important thing is to persevere. Many times there will be difficult clients, for example, clients that you have seen for multiple sessions, but although you've seen for quite a few sessions, still no improvements have come. And at this point, a lot of therapists can feel insecure and feel like they're not doing a good job. Okay. At this point, they might feel let down. But yeah, it's important to push through. It's important to seek mentorship and to find out what are we doing wrong and to improve our knowledge and to try different things. Right? Instead of trying the same thing, if it doesn't work and keep on trying the same thing, right, which is not the smart way to solve problems. Instead, improve our knowledge, seek guidance, and yeah, work on our weaknesses. Right. Besides that, it's also important to put down our ego or to learn from our mistakes, because sometimes wrong diagnosis can be made. At this point, it's important to step back, to reevaluate, and to reassess. Okay. Besides that, it's also important to the consider to refer, because sometimes also we might see a patient for a few sessions despite doing different techniques, despite getting mentorship, still there's no improvements in the client. At this point, probably there's no therapeutic relationship between the therapist and the client. If there's no strong relationship, if there's no strong bond, then for sure therapy is going to be hard to take place. Which is why psychologists should also always consider to refer when things don't work out, right? Okay, emotional intelligence is also something that is very important because understandably, empathy fatigue is a real thing and it can lead to very high stress. So by having emotional intelligence, it will help the psychologists to detach themselves from the clients, right? As opposed to going back home and still thinking about the things that have been told to them, right? Still thinking about the clients. This can affect the mental health of the psychologist as well, right? Which is why it's important to set boundaries and to have a high emotional intelligence. All right. Next, it's also important to have strong communication and communicational skills. Because at the end of the day, the main thing done by psychologists is through communication. Right? Anything we do, either assessments or diagnosis or treatment, we do it through communications. So yes, definitely strong communication skill is needed. But I also want to say that if you ever feel like your communication skill is not great, it does not mean that you will not become a good psychologist, right? Because at the end of the day, communication is a skill. A skill is something that you can develop, okay? Which is why after your degree, it's the perfect time to try out the things that we are uncomfortable with. For example, I spent 2 jobs working with kids because working with kids was something I was uncomfortable with. So after I had those experience, I became more comfortable working with kids. Similarly, if you feel like communication is your weakness, then yeah, further experience and further exposure to situations where you have to use communication skill can definitely improve the skill. All right, so finally, one of the most important things to do for yourself as a clinical psychologist to de-stress is to have your own self-care. All right, so most of you might know what self-care routines are. Yeah, self-care routines are straightforward, right? It is things you do that can make you happy. Okay. But yeah, I want to clarify something. It's things you do that can make you happy. But some of you might think that, I feel like I want to work out because working out is healthy and I should work out. But then you work out and you don't like working out, and working out stresses you. And if it stresses you, then it's not really a self care. Okay. Self care is something that takes away from your stress instead of give you stress. So yeah, which is why self-care are simple things that makes you happy. Can be like taking a shower, talking to a friend, playing games, or reading a book. Okay. Things you do to detach yourself from the work. For me, it would be my hobbies. I enjoy working with metal, right? Shaping metal. And in this picture, I um, made a Batman batarang. Yeah. Besides that, I also I enjoy playing video games, and video games is something I do to mostly detach from my work. Besides that, on weekends, I also usually go hiking, right, with my friends. So yes, these are the things I do for my self care, and the things I do to keep myself sane, so I can help people with mental illness. So yes, that's all what I have to say for today. And now I'll be open for questions.
Okay, everyone. So now, should you all have questions, please post it at the YouTube comments and we should highlight them on the screen, yeah? It could be about anything regarding the presentation or what your thoughts could be regarding the field.
So, what types of treatments will be given in clinical psychology? Um, yeah, as mentioned just now, most of the psychologists in Malaysia they are um, trained under cognitive behavioral therapy. So, cognitive behavioral therapy is a form of therapy where you um, change the thought patterns and you change the behavior patterns. All right. So through process of homeworks, through process of exploration of the thought processes, we will identify what are the areas of concern. Yeah. So yeah, the main type of treatment that is done by clinical psychologists in Malaysia would definitely be cognitive behavioral therapy, which is something that can help with different types of disorders.
Okay, so we have one more question by Sophia Alif. How do you take care of yourself, Mr. Rauf, since every day you are dealing with clients' problem, their negative vibes, etc.? Does it affect your own mental health?
Yeah, as mentioned just now, empathy fatigue is a real thing, right? And I have experienced empathy fatigue. So yeah, what's best to do here is to have boundaries, right? Is to have the things that you like to do that doesn't remind you of work. For example, when I go home, as mentioned just now, I have my hobbies. My hobbies are very extremely unrelated to psychology. The more unrelated it is to psychology, the more it takes my mind away from the field, right? The stresses that I see throughout the day. So yeah, the further my hobbies are away from the field, the better it helps to improve my mental health. But for sure, the sometimes when we see clients back to back, right, for days and days, it can lead to empathy fatigue and it can lead to feeling stressed out and you would want to go home and just isolate yourself. But at the end of the day, just doing the hobbies after 1 or 2 hours, you're able to get back to your usual self and can interact normally with your family and friends.
Okay, there you go. Another question is by ZJ. Sir, do you think introvert person suitable for this field?
I'll give myself as an example. I would say myself as like 9 out of 10 introvert. You know, I'm not kidding. I'm not exaggerating. I'm a 9 out of 10 introvert, meaning I'm quite highly introvert. What I mean by that is I truly enjoy my alone time at home. Right? If I can get a chance, opportunity to go back early, to go back to my home, oh, I would love that. So yeah, definitely, I would say introvert is they can be good in this job, right? Okay, another thing I want to clarify. Some people might say like, oh, introverts are shy people. Introverts are people who are awkward. I, I would say those are false, right? Yes, introverts are more likely to be shy, more likely to be awkward, but they are not directly related. Introvert is just means people who they need their alone time after they interact in social interactions. So after they're outside, then they need their alone time. Does not mean that they have to be shy. They have to be awkward. These things are, other things altogether. But yeah, if even if you're shy, even if you feel yourself as an awkward, I see myself as someone shy and awkward too. But yeah, through experience, through building your experience and confidence, then yeah, you can effectively do well in the field.
All right, good to know. We have one question from Asia Pacific University. In your opinion, which psychology field is in demand, especially in Malaysia?
So yes, in my experience, clinical psychology for sure. But yeah, I've talked a lot about that. But other than clinical psychology, something that is also high in demand is also developmental psychology. There's a lot of kids with neurodevelopmental disorders such as ADHD, autism, learning disabilities, and intellectual disabilities, right? A lot of kids struggling with these kinds of difficulties. Because they struggle with these kinds of difficulties, they cannot go to normal school. So they will have to go to special school. There will also be special centers that can educate these kind of kids. And the kinds of psychologists that will be working in these kind of places are developmental psychologists. So yes, in KL especially, various centers that provides rehab for kids with neurodevelopmental disabilities. So yes, besides clinical psychology, I would also say psychologists working with kids is very in high demand.
Okay, good to know. Another question by Aina Abdullah. How many total of mental disorders in DSM 5? Are the numbers increasing from DSM 1 to 5?
Oof. How many numbers? Well, unfortunately, I don't know how many number, but yeah, that's a lot. That's a lot. Some of the changes from DSM-5 to DSM-1 to DSM-5 is that, well, the types of things that they refer to as disorders, right? Over time, it definitely changed. Because for one good example from DSM-4 to DSM-5 was the introduction of secondary diagnosis, right? For example, a person might be given one diagnosis, but there might also be another diagnosis that um, interrelates with the first diagnosis. Okay, so yes, that was something that was introduced in DSM-4, but DSM-5 we removed this. We completely have removed this already. There's only there's no like secondary diagnosis anymore. Instead, what they have is primary diagnosis as well as um, the other diagnosis that affects the person as well. There's no more term as a secondary diagnosis or as a secondary concerns. Yeah, those things were present in the DSM-4, but it's removed from the DSM-5. And for sure, there's a new DSM that is being, how to say, authored, that is being produced right now. And this new DSM-5 is going to make some changes to the current DSM as well. Because some of the things that are included in the current DSM is, for example, gender dysphoria, right? Which is something that is very heavily debated. Because DSM still lists people who are homosexual as a disorder. But a lot of people think that homosexual is not a disorder. So this is definitely something that is being heavily debated now. And yeah, there are chances of things like this being removed or being updated in later versions of the DSM.
Okay, that's good to know. Moving on to the next question, we have by Sophia Alif. Is it ethical to provide therapy to someone you knew? For example, your ex-girlfriend or family members?
Yes, so it's unethical to provide therapy for someone that you know because, well, there'd be a lot of conflicts, right? I mean, the information that you get from the therapy, it's gonna be hard to be non-biased, right? It might also affect your relationships after the therapy, and because your client is a friend or your client is a ex-girlfriend, for example, or a family member, because it's someone that you know, then the client might also have certain dependencies towards you. They might feel like, oh, since you're someone I know, so why can't we have therapy sessions every day? Why can't we have therapy sessions more often? So yeah, their expectations might also be not realistic. Yeah, which is why there's a lot of different concerns lah, when we see our family, friends, or people we know as our clients. Which is why it's always what is done is our family and friends will be referred to another psychologist.
Okay, understandable. Moving on to the next question. By YouTube user, does a clinical psychologist often conduct researches as well?
Well, yes. Yeah, I mean, they do conduct researches. But yeah, something I want to say about this is that a lot of psychologists, they conduct research, but it doesn't mean only the psychologists in universities, right? A lot of psychologists in hospitals, in private clinics, they also conduct researches. Because yeah, I mean, there's not a lot of studies in psychology being conducted in Malaysia, in our population. Most of the studies in psychology are conducted in Western population, and the information that we get is very Western biased, which I'm sure most of you are aware of, right? Which is why a lot of psychologists, they also try to increase the amount of knowledge we have about the Malaysian population. But at the end of the day, right, it depends on your interests. It depends on your ability to manage your time. Because for sure, when you spend a lot of time seeing clients, it's going to be very hard to find time to manage your stress, to do research some more. But hey, if you can do it, awesome. Right?
Okay, thank you. Moving on to the next question by Catherine Chung. How to break open on a person who is not willing to open up with their issue?
So I guess you're asking this in the perspective of maybe you want to advise someone to seek for therapy. right? This is a common question that I get asked. How do I influence my friend to go for therapy? Okay, so what I would say regarding this is that, um, well, yeah, sometimes what we would say is we would give them the benefits of going to therapy, right? It's simple. When we tell them, hey, going to therapy, you can learn coping skills, right? We can learn to handle your problems better. That everyone knows. That is something that they can think of themselves. But something else you can say is, what are the consequences if you do not go to therapy? This is something that's important. So among the consequences if you don't go to therapy is that, um, when you think a certain way, right? When we have a belief about ourselves, when we have like a negative thought and we don't challenge the negative thought and we think a certain way for decades and decades and decades, the longer we think a certain way, the harder it's going to be for us to change it, right? And once we think a certain way and we reach 50s or 60s and when we have like serious problems, serious life adversities, without the coping skills, without the necessary ways to overcome the problem, it's going to be even harder to manage the mental health concerns at that time. Which is why I always say it's a good idea to develop coping skills to address the concerns we have early on. The earlier you have coping skills, the better, because you can keep on using the skills in 10 years, 20 years, 30 years, right? So yes, the benefits of going to therapy, it's clear for everyone. But what you can say to your friend is tell them what are the consequences if they don't go to therapy. They will not develop coping skills. They will struggle with the same problems for decades and decades, right? Because the reason they are suffering is because they lack the coping skills. And once they develop the coping skills, suffering is a choice. Yes, those are some of the things that you can tell your friend to convince them to open up about the issue.
Thank you, sir. Let's move on to the next question by Adeline Khan. What is the most unforgettable case that you have treated?
Okay, I'll give two. So one of it was a child student, and the child student, I showed the picture in my slides just now. It was the kid who was sitting on my lap. That was one of the most unforgettable case because, yeah, it was a very difficult case. Difficult case because this child has ADHD. He's 6 years old and he's very severe inattentive, very severe hyperactivity. And he also has very severe behavioral problems. And when I talk about behavioral problems, I mean he bites people, he spits on people, he would hit people, he throws things at people. So yes, it's very difficult to handle him. So yes, it's definitely an unforgettable case, but I feel like it's unforgettable because I managed to crack him, right? I managed to, by using punishments, by teaching him consequences for his behavior, I managed to make him follow my instructions. And by having the consequences that he's afraid of, right, and by having the proper motivations to make him do the things I want him to do, then it became easier. I started to share the things I know with the parents. And the parents also felt very happy now that they have a way to parent their child like how they're supposed to, right? So yeah, this was definitely a very rewarding experience. So that was a child. As for adult, yeah, one of the most unforgettable case that I've seen was a lady who has a substance-induced psychosis. What that means is she's a drug addict. She takes meth, and because she takes meth, sometimes it can lead to schizophrenia. You see things that are not there. You hear things that are not there. You believe in things that are untrue. So for this particular patient, she would believe that she is a god. And this one time she became very aggressive. She would take a knife and chop her father's head. So yeah, unforgettable case, definitely. But yeah, because she struggles with schizophrenia and because it's substance-induced schizophrenia, right? Once she stopped taking the meth, she stopped having schizophrenia altogether. So yes, the treatment method for her was to get her off the dependency on meth.
Okay,
All
that
right.
was quite a surprising answer. Did not expect that. But let's move on to the next question. How about by JK? Is the amount of people seeking for mental health help increasing due to the pandemic? In your opinion, what is the source of their mental health issues?
Okay, so yeah, I can give a very specific timeline. Around June last year, when the second wave of MCO started, right? When the cases started rising up again, and when the full lockdown started again, that's when there was a major sudden rush of new clients. A lot of people were very like stressed out, having to spend more time at home because at that point they were already able to go out, and then suddenly cases started rising, and now they have to stay at home indefinitely, right? Don't know for how long. So yeah, at this time there was definitely like increase in mental health cases, and I would say it's still ongoing until now, because although now there's no lockdown and all, right? But I feel like most of the concerns, most of the sources of the stress, sources of the issues are still present. For example, financial concerns, and also people working from homes. People working from homes when they're isolated from their friends, doing the same thing over and over again, right? Doing the same thing over and over again without the distractions. What people notice is that when they don't have distractions, the voices they have inside their head gets louder and louder and louder and louder, until the point it's hard. They become very anxious, they become very stressed out, and it leads to worsening of their mental health. So yes, the without the distractions is also a form of the source of the issue. Besides that, it's also, yeah, isolation, not being able to meet your family, because for a lot of people, family is their main source of support. Sometimes they work like in KL, but their family is in Penang, for example. Their family is a major source of support, and without being able to see their family, to be around their family, can also be a major source of concern for them. So once they realize there's no support, suddenly all the other problems, like their anxiety of work, their insecurity, all these problems would be heightened because the support is not there. So that's why, yeah, these are the concerns that people will have around during the pandemic. But yeah, one thing I want to say is that it's not that the pandemic triggers the issue. You know, what the pandemic does, it makes the issue more prominent. The issue has always been there. They have always had difficulties with anxiety, insecurity, or depression, or their self-esteem, right? The issue has already been there, but it's underlying. The pandemic, due to the effects of the pandemic, it brought all these concerns to the forefront, and which is why more people realize they need mental health support, and more people are advocating for seeking mental health support.
Okay, sir, very understandable answer. Hopefully, those that are watching can find solutions just by hearing that answer. Now, moving on to the next question, we have by Sophia Alif. How many clients or sessions you have in one day? What if your clients call you in the middle of the night? They need your help or come out with suicidal thoughts. How do you handle this?
All right. So I handle clients based on the schedule. It's 3 clients a day, but sometimes some of the clients can be assessment cases, and assessment cases can take more than 2 hours. So yeah, 3 clients a day can take up more than 5 hours at times. Okay, so yes, yeah. What if clients call me in the middle of the night? Thankfully, that doesn't happen because this is a private clinic. So our working hours are from 9 to 5, right? But we do also inform our clients that whenever they have like suicidal thoughts, right? Whenever they are stressed out, when they're alone, they need someone to talk to. We offer them numbers that they can call to seek support. So this is something that we always inform the patients. We always let them know of things they can do. Excuse me. We always let them know of the things they can do when they reach their, how to say, most distressed period. Yeah. For example, things they can do. For example, who they can call, what kind of support they can get, what are the kinds of distractions they can do, what are relaxation techniques that they can perform. Uh, so like a safety plan for them.
Okay, thank you for your answer, sir. Moving on to the next question by Ko Jaja. What is the greatest impact of learning psychology on you?
Um, one reason why I wanted to become a psychologist in the beginning is also because I've always struggled with social anxiety, and when I was in teenager, because of the social anxiety, it also led to me being depressed. Right. So I would say one of the greatest impact of learning psychology for me was to be better able to understand myself, to understand what I've been avoiding. Right. Maybe I understand what I need to do, but I've been avoiding what I need to do. So putting all these problems in the forefront, understanding myself and understanding why I do the things I do, right? Understanding my upbringing, the environment I grew up in, and how all these things can affect who I am. So yeah, definitely things like this has the greatest impact of me learning psychology. Yeah, besides also understanding, right? Understanding more about myself. Yeah. So definitely I would say a lot of benefits of learning psychology. Even if you do not intend to pursue clinical psychology, just by learning psychology degree, a lot of different benefits it can have on you or it can have on the other jobs that you want to do. As long as you want to work with other people, then yeah, psychology is really going to benefit you.
Okay, thank you, sir. Let's move on to the next question by Nabil Huda.
Hello.
Oh, hello. Okay,
Yeah, hello. Okay.
okay. Sorry about that.
No
So,
problem.
moving on to the next question by Madeline Alexis Batin. Hi, how do you know if being a clinical psychologist is the right path for you? I mean, you could have taken other related health fields.
Well, okay, if you want to know for me, right? Well, I like to help people. So hence I was looking at the health field. So when you say helping people and when you say health field, first thing you would think about is a doctor, right? So I was contemplating that as well. But I decided to not go into medicine because I like to help people through therapy, meaning through interactions, through communications, as opposed to prescribing medications. As a personal how to say value, right, or personal interest of mine is to use communication techniques, to use therapy, as opposed to prescribing medications where it seems more of a very black or white kind of treatment. Therapy seems more subjective, right? Person having depression can be very different from someone else having depression. So yes, I feel like my interest and my passion, I feel like it's more subjective. It's not really black or white, right? For example, if someone has anxiety, prescribe them with a certain medication. If the certain medication has side effects, I would prescribe them with a different medication. So yes, as opposed to that, I preferred the path of using therapy, talking to them and understanding them as humans, not as hormones and chemicals and genetics, understanding them as real life walking humans.
Okay, thank you, sir. Moving on to the next question by Nabila Huda. What aspect of clinical work do you least or most enjoy?
Least enjoy. Um, mm, okay, yeah, I know. Yes. Least enjoy couples therapy. Right. Couples therapy is something I least enjoy. At the end of the day, it's something of my interest. I feel I have no interest in couples therapy, and the techniques used in couples therapy is also different from handling mental illnesses. Right. When you handle mental illness, you would do things like CBT or other forms of therapy modalities. But in couples therapy, there are similar things such as that, but it's more relationship based, right? Um, Healthy communications and managing anger, things like that. So yes, it depends on the interest. I guess for me, I would say my interest is not really on couples therapy. My interest would be more on treating the mental illnesses.
I see. And as for the most enjoy, what about that one?
The part that I most enjoy is assessments. I love conducting interviews. I love to conduct the assessment tools, like what I showed, the intelligence test. That is my favorite assessment to do, right? Because there's a lot of like items to use, and then it feels like a game at the end of the day. It feels like you're running a what do you call, a reality show, where you have a game and there are contestants trying to play the game. So yeah, I would say that's my most favorite part of being a therapist, which is the assessment.
Okay, sounds interesting. Moving on to
Yes.
the next question, we have by Sophia Alif. What is the range of salary for clinical psychologists in Malaysia?
Okay, so once you have graduated, right, you should expect a salary most of the time, right? Your salary will be in between 2.8K to 3.3. Okay, this is the expected amount that you can get after you freshly graduate. But yeah, over time, definitely over time, the prices would definitely increase depending on the years you have worked. I know of clinical psychologists who have been working for decades and they get paid um, close to 15,000 per month, right? It also depends on where you work. If you work in a KKM in a government hospital, understandably the pay will be less. But if you work in a private center as well as being consultant in other places, so you will get pay from the private center as well as your consultancy. Your consultancy can be like a part-time job. And sometimes in the consultancy, right, one session that you see, you can get as high as 400, 500. Just one session of 1 hour. Yeah. So imagine working on weekends. Imagine seeing a few clients on Saturday. You can already get like few thousand in one day.
Thank you,
So,
sir.
so that definitely something for all of you to think about, right? To consider because that definitely, I mean, the pay it can be good depending on where you want to pursue, right? If you're worried about the pay, then hey, you can get good pay in clinical psychology.
Okay. I think for most clinical psychologists, it's not really about the payment, right? It's about the experience to help people. I think that's
Exactly.
how
Most
they,
people who
yeah.
take up good point. Most people who take up clinical psychology, they like to help people, you know, and the incentive is to help underprivileged populations and not to like live comfortably, right?
Okay, thank you, sir. Moving on to the next question, we have by Ahmed Umar. What advice would you give to someone considering a career in clinical psychology?
Okay, something that I've repeated just now a few times. One main advice and one thing I want to say to all of you is like after the degree, right? If you like clinical psychology, the things you need to improve on in the experience is experience working with kids, experience working with different population, right? Not just working with the high income people, but also working with the lower income populations, right? Not just working with normal adults, also working with adults with OKU, adults who are OKU. Okay, so yes, my advice would be to expand your experience, work in different types of jobs. Don't just start one job and stick to it. My advice would be try one thing for a while and then try something else. The more experiences you have in your resume, the easier it will be also to apply for clinical psychology. Because for sure, your academics is important, but the experience you have is also equally important to apply for clinical psychology, as well as to be a good therapist.
Okay, thank you for your answer, sir. Moving on to the next question by Lo Tung Xuan. I'm sorry if I pronounced it wrong. Do you ever feel overwhelmed from helping other people's mental health issue? If you do, how do you overcome it?
Self care routines, right? Having hobbies and having ways to detach ourselves from the concerns of our clients. If we do not have these things, that's when we will go into problems, right? So yeah, hobbies, self-care routines. I cannot emphasize how important that is.
Okay, sir.
Yeah,
Understandable.
sorry. Another thing I want to say, the further away your hobbies are away from your field, the better it is, right? So if you're working in mental health, then your hobbies try to make it something unrelated, right? The further related it is, the better it will be for your mental health.
Okay, sir. Very good. Moving on to the next question by Nabila Huda. Does a clinical psychologist seek mental health treatment as well?
Of
Interesting.
course, yes, definitely. It's something that we have gone through when we were in psych degree itself, right? But yeah, clinical psychologists do sometimes seek mental health treatment as well, because understandably, even for doctors, something that is always said in the healthcare field is that we should not treat ourselves, right? It's when we treat ourselves that's when we will lead into problems, especially in mental health. Because in mental health concerns, there will be a lot of bias. We might feel like, oh, the way I think, okay, what's wrong with the way I think? Yeah, we wouldn't know the problems in our way of thinking, right? Which is why when it comes to um, if a therapist is struggling with anxiety, struggling with depression, it's always a good idea to seek a different perspective, right? I know of a lot of my colleagues and a lot of my classmates who, after feeling stressed out, after feeling empathy fatigue, they have seeked for mental health support. And after seeking for mental health support, they realize that they can become a better therapist after that. So it's not something that I would say is rare. It's something that I would say I recommend therapists to go through.
Okay, sir. Thank you for the information. Let's go to the next question by Sophia Alif. Have you ever had difficulties working with parents who refuse or in denial to accept their kids' issues, such as autism or ADHD?
Mm, mm. Usually, most of the time, the parents wouldn't be in denial because the parents are the people who bring the child to get assessed, right? So, since the parents are the person who brought the child to get assessed, meaning the parents kind of feel like the children has some concerns, which is why they want to get them assessed. So yeah, but yeah, sometimes there are denials, right? Where there can be denial is when, as a therapist, we tell to the parents that sometimes the parenting techniques can sometimes worsen the children's problems. For example, children with behavioral problems, children who don't like to follow instructions. And when you interview the parents, you find out the parents are very permissive. Anything the child wants, the parents will give. If the child is crying for something, the parents will give. And sometimes when you provide parenting training, right, to these parents, yeah, parenting training is where parents can get defensive. Parents might feel like, hey, I'm just making my child happy. What's wrong with that? As long as they're happy, what's wrong? But yeah, that's what we learn in parenting. Parenting is not about only making the child happy, right? That's not the purpose of parenting. Purpose of parenting is to provide skills to the child so that they will become a healthy, functioning adult in society. That's the purpose of parenting, not to make the child happy all the time. Sometimes disciplining is required. Sometimes teaching consequences is required. So yes, talking about these things can sometimes cause the parents to be in denial.
Thank you, sir, for your answer. Let's move on to the next question by Wenshu Ko. What do you do when your friend suffers from depression and sends you negative energy every day, but you have no way to guide him and even let yourself fall into negative emotions every day?
Well, yeah, I guess it's similar to the question just now of how do you encourage your friend to seek for support? Because at this point, right, it sounds like you want to ideally, you want to advise your friend to seek for support. Once your friend seeks for support, then they wouldn't send you negative energy as much. So yes, yeah, it comes back to how to influence your friend to seek for therapy. What you can do is can kind of advise them about the consequences of not going to therapy. As mentioned just now, right? Not going to therapy, you're not going to develop coping skills. You're not going to understand your concerns. And also, by developing coping skills, you're going to be equipped in handling your concerns in the next few decades, right? So yes, definitely a lot of consequences if you do not take therapy.
Thank you, sir. I think it can be summed up as prevention is better than cure, right? In that case.
True, very good point. Yeah.
So moving on to the next question, we have by Catherine Chong. How do we convince the older generations that therapy works and mental health issues are real?
Very good question. This is a very big problem, right? Because a lot of the clients I have are very young. You know, the clients I have are young and they come to therapy without the parents' knowledge. Because if the parents know, the parents will say things like, "Oh, you're just not working hard enough. You're not praying hard enough. That's why you're having these problems," right? So when the client they hear all this, they may feel like invalidated about their problems. They feel like their problems are just not real. So definitely, it can be very stressful for a lot of people when they have parents or older generation that are unsupportive. So yes, how do we convince them? That is a very difficult thing to do, because something that I always say, right? And I don't mean this as an offense, but something I always say as a joke is that um, you can't teach new tricks to old dogs. So yeah, people of older generation, they have gone through life thinking a certain way. The older you get, the more the way you think is solidified. You know, and for you to say you want to change the way they think, and I want to make them like accept that you're going to therapy, I feel like it's possible, but it's highly unlikely. Instead, the solution in this kind of situation, right, is not to hope and wait for the older generation to change. Instead, it's to accept that they won't change. You know, the more we wait for them to change, we're just gonna get more and more upset, more and more disappointed, more stressed out. Instead, just accept that we can't teach new tricks to old dogs. And the more we hope on it, we're just gonna keep suffering, keep hurting ourselves.
Okay, sir. Hopefully that is easily applicable for our viewers. Now, moving on to the last question. By Ko Jaja, if you are not having a good day, will your bad moods influence you while conducting treatment with your clients?
Definitely, definitely. Which is why before the session, right, what I usually do is I would sit down in a private place. I would go through the case notes, go through the things that we have done in the previous sessions with the client, just to get my mind in the zone, you know, because I might be worried about other things. I might be worried about the things I have to do or the problems I have. But before the session, if I just take half an hour to just read through all the notes that I have wrote and to just go through the case summary, right? This way, it can help me to get in the zone, to get in the mood, to get in the client's environment. Once I can get into the client's environment, then it's easier for me to detach from my problems and attach to what the client is saying. So once the session has finished, then I would do the opposite. I would detach from the client and attach to my real life.
Yes, that's a good advice, right? Wouldn't want to say the wrong things at the wrong state of mind.
Yes, yeah,
So,
for sure.
so I think we are almost, actually, we are quite past our ending time. So maybe this is where we should end our webinar. So that concludes our webinar for the day. I would like to convey my sincere gratitude to Mr. Abdul Raouf. Thank you so much for spending us your precious time to be with us today. I'm sure you're a busy person, and the information you shared was very inspiring. A lot of it was very important and crucial, especially for aspiring psychologists, the ones that are watching currently. We hope this program has given the audience a very positive experience as well. And on behalf of the organizing committees, uh, I would like to apologize if we have done any mistakes throughout the session. Maybe we mispronounced your name at certain points or other audiences. We truly hope that you have experienced and enjoyed this webinar session and have a good learning experience. So with that being said, thank you everyone for attending. Stay safe and have a nice day.
All right, thank you to everyone too.